He got traded for
I mean,
Michigan.
I'm just now getting used to some of this, and I got traded for.
Hey guys, thanks for joining us. Clearly we're in a very serious mood today. I think, Governor, if you want to open with comments about the new TDH visitation policy, then we'll get started with questions. Let's start on this side of the room and circle around when we get started on that. Any comments?
Yep. It is a serious subject that we're very pleased to announce that we'll be lifting all the visitation restrictions on nursing homes. We have vaccinated every resident of every nursing home, and will within a week have every resident of every long-term care facility vaccinated, and with a full vaccination regimen. So we're lifting the visitation requirements. There has been a lot of isolation and a lot of separation for a lot of the elderly in our state, and so we're really glad to be in the spot, and that'll be a part of our announcements in the next couple of days. So we'll start off with that piece of good news and answer questions.
Thank you, Governor. So yesterday the Senate sent a letter to the chancellors and presidents of the universities telling them to ban student athletes who decide to protest or kneel. Do you think that the First Amendment rights of the student athletes end when they start wearing a jersey?
I think that the national anthem is a great opportunity for Americans to participate in something that's unifying. I think it's deeply unfortunate and disappointing to take that moment to protest. Creates divisiveness in the midst of a time that ought to be unifying. So that's what I think about protesting during the national anthem.
So you might not like it, but they have a right.
Oh, the First Amendment is an important part of our Constitution, and thank you. But I don't think it's the best time.
You don't think? Okay, sorry. I just want to clarify. So do you think students should be banned? And I'm asking this because we've heard from people. Are you here, Governor, with us? Oh.
I'm just.
We still, we've heard from people that are worried that these types of bans, if they happen, they are gonna make it hard for universities to recruit athletes because they are being banned from exercising.
So we'll see where that piece of legislation goes. I'll just say that I think it's a bad idea to protest in the midst of the national anthem.
Governor, I wanted to ask you about Shelby County. On top of the wasted doses that were announced, it was also reported that they had an excess in inventory when it comes to the shots. How confident are you that that's not happening in other parts of the state? Do you believe that the state needs to do any sort of review in other parts just to make sure that pharmacies, other counties are just sitting on tens of thousands of doses?
Yeah. So we actually are engaging with other states and with other counties and other health departments, as we have been throughout this pandemic, and what we're finding is very encouraging. So we believe that the process is good in 94 of our 95 counties. We are disappointed in what's happened in Shelby County, but we swiftly took action as soon as we knew there was an issue. As you know, we have put people on the ground there. We've changed the process. We are moving vaccines. We are changing the distribution in Shelby County, all because we don't want to slow down the vaccination process at all. We want to make sure that Memphians and those that live in Shelby County continue on with the vaccination process. We want to speed it up, actually. So we're concerned about what's happening there. We're intervening there, but we are contacting and moving through health departments all over the state to make sure we don't have any other issues.
Do you see Shelby County ever getting authority back to distributing rather than going through the city and local hospitals?
I think right now what we're focused on is solving the problem at hand. What happens in the future will change with regard to the amount of vaccines we have and what the distribution process looks like going forward. Our job right now is to get the vaccines into the arms of Shelby Countyans and do it effectively and efficiently, and so that's what we're focused on.
Governor, on the topic of Shelby County, I have a question from our sister paper in Memphis. Have you all been able to confirm that no expired doses were administered in Shelby County?
I have no knowledge of that at all, so I really can't comment on that. I don't have any knowledge of that at all.
Okay. And then on the constitutional carry bill that is up in House Committee today, they're again going to hear from law enforcement leaders who said they're opposed to this bill as they pass it for years. As a supporter of law enforcement and the police, does their feedback not play into your support of this measure?
I think their feedback's important. In fact, feedback from stakeholders and citizens all across the state is important, and it's a part of what shapes the policy that we bring forth going forward. What I do think is that it's possible to protect the Second Amendment and the rights that Americans have regarding the Second Amendment and the ability to bear arms that is not hindered by the government. You can protect the Second Amendment and you can protect the citizens of our state at the same time. We can have safe neighborhoods and a strong protection of the Second Amendment. I believe we've seen that in 17 other states across the country. So their feedback is important, as is feedback from any citizen on this issue.
And what about the law enforcement leaders and police chiefs who are saying this would make their officers more accountable? What do you say to them when they're telling you?
I say that I'm interested in their feedback. I want to understand why they're concerned about that, and I think that we can protect our law enforcement, we can protect our citizenry, and we can protect Second Amendment rights all at the same time.
Hi, I have two questions for you. The first on education. Revenue in January was strong again, or at least better than we thought. Worst case scenario was last year. If it continues to be strong in the coming months, would you step in and ask the legislature to put some of that extra revenue toward education in addition to fully funding the BPP and make up what some people call the net funding gap?
Well, first of all, let me say that I hope you're right in your prediction, or at least your idea that we have better revenues than we expected. We hope that happens. We hope our economy is even stronger, because what it will allow us to do is to then consider where we will invest those funds in the future. Education is a top priority of mine. It has been. We've made significant investments in education, and I suspect if we have revenue increases in the months and years ahead, education will be at the top of the list for areas that we would invest.
My other question is about unemployment. In the early stages of the pandemic, people would come and ask, can you help me with my claim? And they were overwhelmed. And we would ask, and usually they were able to fix their claim. I know lawmakers did the same to their constituents. But now the answer a lot of times is that it's just a backlog, and it's out of the department's control. And people are waiting 9 weeks, 12 weeks longer. Now, for something that they're really not getting answers for why they're waiting for that. I mean, how is that acceptable? And do you know why we have a backlog? I mean, maybe it's a very technical answer,
Yeah.
but I've not been able to find that.
Yeah, so many people get their unemployment claims processed in a very timely fashion. Many people have technical problems with their applications. There are as many different challenges with an unemployment claim as there are types of claims. I'm very proud of the work that Department of Labor and Workforce has done to stand up multiple unemployment programs over this pandemic. And actually the claim turnaround time is quite good. There are claims that take weeks and months to process, but there are generally challenges or issues with those claims when they have a claims adjudicator assigned to them. There are complications with those claims. So we can find plenty of times when claims take weeks, but oftentimes, and more often than not, there's a reason for that.
But 70 and 80,000 on the backlog seems high, right?
There are a lot of unemployment claims making their way through the system right now, and there are a lot of folks that continue to be out of work, and we're working really hard to make sure that they get the claims that they need.
All right, Governor, and in regards to what happened in Shelby County, what have the conversations been like with our federal partners, and are they going to be intervening in any way?
So we expect the CDC to be on the ground in Shelby County along with our Tennessee Department of Health. The Shelby County Health Department has been very cooperative with regard to wanting assistance. As you know, we are moving the location of the storage of those vaccines that currently reside within the plan is to move them. And we're also moving the distribution of future vaccines to other partners within Shelby County. It's really important to us that the process not slow down at all, that there not be a pause at all in the distribution of vaccines in Shelby County. That combination of resources and help from the federal government and the State Department of Health, we feel like it's going to correct the situation quickly.
And jumping off the Memphis for an affiliate in Memphis, they say, have you or would you consider having the state take over the operations from the Shelby County Health Department?
Well, what we're doing is intervening in the operation. We are requesting data, information, daily check-ins. We're embedding personnel within the department, including CDC personnel. And as I said, moving vaccines from that department to another holding site and distribution away. So making a major intervention that we think is going to be actually more effective than taking over. Taking over would mean halting the process for a period of time until others learned the local process there. We're very focused on not having a pause, keeping the vaccines going. So we've done a lot of work over the last 4 or 5 days to develop a strategy that we think is going to be most efficient.
And for me, Johnson & Johnson just coming down the pipeline with a possible vaccine, more vaccinations becoming available. However, throughout the United States, African Americans have been vaccinated at a lower rate. Do you think Tennessee has done enough to vaccinate African Americans who life expectancies are shorter than those of their counterparts?
This morning, I met with Dr. Lamar, who heads up our Minority Health and Disparities Elimination Group, for a briefing on our strategy for vaccination, especially in minority and ethnic groups across the state. We have a very developed plan working with African American leaders, Hispanic leaders, Black church leaders across the state. We have not only with testing, but with vaccinations. So we know that it's a challenge, and yet we have taken a sector of our Department of Health and created a focus entirely on getting access to access for minority communities to vaccines. We feel good about that approach, and we really are fundamentally committed that every Tennessean should have access to a vaccine.
Three questions about the changes to the long-term care facilities. So just to make sure I understand this, it sounds like the state is moving from state visitation regulations that facilities have to follow to federal visitation guidelines that they're encouraged to follow. Is that correct?
Well, so any state-imposed requirement is being removed. There are independent requirements from individual long-term care facilities. There are CMS requirements on nursing homes and long-term care facilities. So there are federal rules, and there are obviously visitation rules that individual facilities have of their own. Any state-imposed restriction above what is imposed by any other authority or organization is being removed.
Second question. My understanding is that one of those state restrictions was that if a facility had a case or a cluster, they were required to close their doors to visitation for 28 days. And the state monitored those to make sure those facilities were closed. Is that restriction being removed? And does that mean that if a facility has a case tomorrow, they do not necessarily have to close their visitation?
So I can't answer that technical question. I believe that's the case, but I would defer to Dr. Piercy on that question. if that is a state imposed restriction that was not there before, then that'll be removed.
Last question, this is the fun one. Do you,
This is a fine one or a fun one? A final one or, yeah, go ahead, yeah.
do you see this as the first thing that Tennessee, as a society, has gotten back because of vaccinations? I cannot think of another restriction or policy or rule that has been lifted as a result of vaccination progress, which makes that seem like a very promising milestone.
Well, we lifted some. We lifted some gathering restrictions. We removed some restrictions on sports gatherings in mid-January. So there are a number of things that have progressively happened since we actually started vaccinating. I think from the very beginning of this pandemic, there were imposed restrictions early on in the 89 counties that the state health department is in charge of. The vast majority of those restrictions ended in the summer. Business restrictions, et cetera.
But were those rules lifted because of the number of people who were vaccinated? Like in this
Oh, no, your question about vaccines?
Yeah.
Yeah, so there have been, as I said, a number of those restrictions lifted since we've vaccinated. But this one is, in my view, the most important.
Thank you.
On the education savings account case that the Tennessee Supreme Court will hear soon, the children that would have benefited from that program, those all live in districts that recently announced going back to school. And that this will start next week, and Nashville is working on a phased-in approach. But do you see the lawsuit that was filed weeks before this almost really shut down as a misstep by these districts that prevented children from potentially seeking other options during this pandemic?
I've always said that I believe parents should have a choice in their kids' education, particularly parents who have no choice but for their child to go to an underperforming school. Low-income kids that are in the school districts that have some of the worst performing schools have no choice. And when those schools are closed to in-person learning, their choices are limited even more. I do believe the education savings account would have provided a great opportunity for those kids. I think it's become more evident that parents need choices in the education of their kids, and I'm very hopeful about the future of that. We'll be prepared, should the court allow, we'll be prepared to implement that program as soon as we find that it's available. I've always thought that was the right opportunity for those parents, and I still do.
And yesterday, Commissioner Schwinn told the Senate Finance Committee that in the next round of federal relief dollars from the federal government, we anticipate more than $2 billion further from the federal government just for education relief. I was wondering, in addition to the literacy initiatives that have already been taken up by the legislature, do you have any specific priorities or goals that you hope to see with that?
I think we'll be focusing on a number of priorities. None of those have been decided yet, but there are a lot of those are being talked about. That pursuit of literacy, the continued pursuit of CTE and vocational education, strengthening of our civics education across the state. Those are a couple of examples of things that we will be looking to do, but it's going to be a tremendous opportunity for us to bridge the gap between the learning loss that occurred in the spring and where we are today, and where we can be in the future.
And on the learning loss, last fall, your administration released projections of projected learning loss. I was wondering if there's any plan to revisit those projections based on data from student assessments that's been taken?
I don't know of plans for that. I'm sure that we are doing assessments of students, and when we get those assessments done, there'll be a great understanding of what's occurred from the pandemic.
Do you anticipate that those projections might change significantly? Some other states have seen their
I can't anticipate what that would be. Same.
Yeah, President Biden has lifted the freeze on Medicaid waivers and agreements. Any concern that they'll wind up rescinding the block grant that you all have agreed to? And, you know, what do you do if they do rescind?
So the negotiation that we made with the federal government will benefit our Medicaid population. And so we have a great deal of concern if that were rescinded, because we have a strong belief that we have a need for more services for our population, and that we can serve them because of the savings that will result from this waiver negotiation that we've had. We have reached out to the Biden administration to express a desire to work with them so that we can retain that waiver, and we're very hopeful about that.
Will there be any effort, if that doesn't work, to try to go ahead and get the extra money that they're offering to expand Medicaid?
Well, we'll have to renegotiate our waiver if this, for whatever reason, were rescinded. We're really hopeful it's not, but we have no idea to know what that would be like. It's hypothetical, so we'll cross that bridge when it comes. But we hope that the waiver that we've negotiated, which will be good for our state, will stay in place.
And where do you stand on the constitutional amendment resolution that would give the legislature confirmation over the AG appointment?
Yeah, I haven't reviewed that amendment proposal. I think that anytime the people have input into that Attorney General process, it's good, but I haven't looked at the particulars of that, so I can't comment on it.
Any concern it would create a government light?
Not without reviewing it first.
All right, folks, that's the time we have for today.
Thank you
so
all.
much.
Appreciate it.
Thank you.
Thank you.
Before y'all go, I just want to introduce myself. I'm Casey.
Casey, Sam.
Yes, so nice to see y'all. I wish I could shake hands and all of that, but